So, I'm going to be reviewing this book today. It's called the Dialectical Behavior Therapy Skills Workbook. And I had previously reviewed this book on Periscope, and my broadcast did not come out correctly. The sound came out very, very low. It did not look good. But the book is really, really good, and it's worth reviewing twice. I feel that this is a very, very important book for those of us that suffer from chronic health conditions. It wasn't designed for people with chronic health conditions, but I really feel that this book is probably should be a staple for people that have issues dealing with day-to-day life with a chronic pain or chronic health condition. So it's definitely worth reviewing twice. So I'm going to review it one more time because I felt that it was an incredibly, incredibly important book. So this book is called the Dialectical Behavior Therapy Skills Workbook. Practical DBT exercises for learning mindfulness, interpersonal effectiveness, emotion regulation, and distress tolerance. And it's by Matthew McKay, Jeffrey C. Wood, and Jeffrey Brantley. And they're all PhDs or MDs. Matthew McKay is a Berkeley professor. Jeffrey C. Wood is a psychiatrist. He treats depression, anxiety, and trauma. And Jeffrey Brantley is an associate professor, I believe, at the Duke Psychiatric Department. He's the founder of the Mindfulness-Based Stress Reduction Program at Duke University. This book is basically a self-help type of book, falls under the category of psychology. It was originally for people with borderline personality disorder or people with chronic suicidal thoughts or suicide attempts. Basically, dialectical behavior therapy was developed by Marsha Linehan for people that were chronically suicidal. It was later used for people that have borderline personality disorder, which is a mental health condition marked by mood dysregulation. Basically, people that have very, very intense feelings and have difficulty regulating them. Not so much controlling them, but kind of containing them and not letting them affect their daily life. And these people with borderline typically have a hard time, with their interpersonal relationships, friends, romantic relationships, family, because they have such difficulty bringing down and sort of containing their emotions. The focus of this book is primarily mindfulness, emotion regulation, and distress tolerance. So the book describes what each of these are, so you don't have to worry about, oh, what is that? The book does describe in the very beginning what each of these are and what they are for. It gives you exercises to practice and perfect each skill. It includes worksheets that can be photocopied, and it's very, very convenient. This is very convenient, and one of my most favorite things about this book is that it has the worksheets that you could just photocopy and fill in whenever you need them. So there's some here. I have sticky notes all over this book. So here's an emotion log. You can photocopy that and fill it in daily. And that's just, whenever you need it. You can make multiple copies and just pull them out whenever you need them. So it's very convenient for the user. And it makes it very easy to practice the skills. It uses regular English, doesn't have medical jargon, doesn't have any kind of technical terms or anything like that. It's very user-friendly, very plain English, very well written and interesting, but it uses just regular English. It's not going to give you all of this crazy mumbo-jumbo out there. It has also mindfulness narratives that can be recorded by you to use when you need them. So basically, it has these like meditation narratives, and let me see if I could find one here. And it tells you that you can actually record them, so you could use a recorder on your phone, and you can record yourself saying these meditations. That way, when you need them, you can just play them back and follow the instructions as you as you do them. So you can guide your own self through them by just pre-recording them. So this one is called Focus Shifting, and as you can see, it's in italics. The part that you would speak and record is all in italics. So you know exactly what to say into the microphone, and then you just save it in your phone and you use it whenever you need it. So, so I've done that. I think I recorded 5 of these exercises to use whenever I need them. So, so it doesn't just tell you go meditate. It actually shows you how. And the book begins with the more simple exercises, the easier exercises for emotional regulation and distress tolerance, and it works its way up to the more complicated, more difficult exercises. So basically, you know, if you're a beginner, you start at the beginning of the book. If you're advanced, you can just go to the end of the book. But it's probably a good idea just to start at the beginning, because we're all beginners, you know, when we are starting something new. So I just started at the beginning. Even though I've been doing meditation for a very, very long time, I just started at the beginning and worked my way up. So that's what I like as well, is that the book is already structured in a way that that will help you to learn these skills. It's not going to start you with a very difficult skill in the beginning. It's going to start you with the easiest thing first and work your way up to the tough part. How does this apply to people with chronic illness? This book was not written for people that are chronically ill or have a chronic pain or chronic health condition, but I picked up the book because I felt that it could possibly help with certain issues that I have dealing with my chronic illness. It can help you in times of despair and hopelessness. And if you have a chronic condition, you will definitely have moments where you just feel so down and so hopeless that, you know, it can be really scary. And those are the moments that this book is very, very necessary. It guides you through the exercises. Like I said, it gives you a step-by-step breakdown of what you need to do. If you start at the beginning of the book, it introduces you to small things, and by the end of the book, you're going to be using those small things and putting them together with other bigger things. So, you know, it's step by step. It breaks it down for you. It has those worksheets. It has those narratives that you can use and have at your disposal. It also, you know, this is a very user-friendly book, but because it also has things that you can take with you. So you don't actually have to lug the book around with you. There's flashcards that you can make to take with you. You put them in your wallet or your purse, and you take them with you so that if you're out at the mall or if you're out with friends and you suddenly start having these, you know, emotional ups and downs, you just pull out the flashcards and it will help you to remember, you know, these are the things that you need to do. It also tells you, you know, carry a picture of someone that inspires you. You know, you could put a picture of Gandhi in your wallet. And whenever you start feeling, you know, that sort of loss of control, you pull out that picture and you look at it and you say, okay, well, this is Gandhi. You know, he was a very calm person, or he was, you know, such an inspiration. I want to be like Gandhi. And then it sort of kind of helps to bring you down. That's just a hypothetical example, but the book gives you certain things like this that you can take with you in case you have an issue while you're out. You know, so it's extremely, extremely accessible. It helps to put things into perspective. So, you know, if you're a person that's very sick and you know, you have suicidal thoughts and you have all of these, you know, issues about maybe even harming yourself, you know, you pull out one of the worksheets. One of the exercises I did was actually the big picture evidence. So when I was feeling down, I pulled out a piece of paper and I just started answering the questions. You know, big picture evidence asks you to evaluate the situation. What is the situation? What is it making you feel? Why is it making you feel that way? What about your situation is true? What about your situation is not true? And it asks, I mean, it slows you down enough so that you can get out of your head and get out of those emotions, and you're writing and you're kind of distracting yourself at the same time, but you're also seeing in writing, this is the situation. Is it really what I think it is? Or is it that my mind is sort of skewing my perspective on the situation? So I tried that exercise. I'm not just speaking and telling you this is a great book, this is a great book. I did have certain situations recently where I had the opportunity to use these skills, and I can tell you that they did help. They did bring me out of my mind and back into my life, and just putting the things on paper and writing them down and seeing, okay, am I being reasonable? Am I being rational? Or am I just being emotional right now? And yes, the exercise did help to bring me down. It's not going to take away your problems. It's not going to take away your pain or your illness. But it will sort of it's like opening a window and getting catching the breeze. It reminds you that you're not just stuck in this room. There's a window that's open. There's a door that you can open. You can walk outside. And that's sort of what this book does for you. There were some sections that do not translate very well to people with chronic illness. There are sections that talk about self-harm because people with suicidal thoughts and people with borderline personality tend to hurt themselves. So there's sections on cutting, substance abuse. There's also a section on judgment, passing judgment. I guess people with a borderline personality have judgments about the world and about people, and it talks about letting go of that kind of judgment. These can be helpful for people with chronic illness. It just depends on, I think, what your symptoms are. If you do harm yourself because of your chronic pain or chronic illness, or if you have a substance abuse issue, maybe you have, painkiller addiction or an alcohol addiction, this can be very, very helpful for you because it does address that in the book. For me, that's not really an issue. So I didn't really focus. I did read everything. I read the book cover to cover, but I did not focus so much on those sections. And I did not do the exercises from those sections because they do have exercises for those specific issues. So if you do have issues in those areas, this book will address those as well. This book is very, my overall feeling about this book as it applies to people with chronic health conditions is that it should be a staple. It should be a staple on your bookshelf because these skills can translate so well to those of us that have a chronic health issue. It's useful, it's convenient. Like I said, you can photocopy pages, you can make flashcards, you can take these skills with you. You can do the meditations, record them, listen to them on I have them. If I go for a drive and I feel like I need to just do a meditation, I've got it recorded on my phone and I can use it. It's designed to be accessible. The language is very down to earth. It's not out there. There's no kind of woo-woo, ethereal kind of descriptions. There's no medical jargon. It's all in plain English, very easy to understand. And it's very interesting as well. It talks about sort of recognizing your feelings because a lot of times people that have these certain mental health conditions, and even us with chronic illness and chronic pain, we stop recognizing our emotions. So it teaches you to distinguish between sadness and disappointment, anger and loneliness, because a lot of times we mix these emotions up. So it brings you to a greater understanding of your own emotions as well. And sometimes we need that, especially when we've been sick for such a long time. We lose that level of recognition of what it is that we're actually feeling. It even has a schedule. It has a schedule at the end of the book that you can photocopy, a daily schedule that tells you, do these exercises at this time or do them this many times a day. That's how specific this book gets. It gives you an actual schedule to follow. So, like I said, my overall impression is that this book is an A+ for those of us that have chronic health conditions. If you have borderline personality, if you have depression, anxiety, suicidal thoughts, definitely get this book. But like I said, even for those of us that are chronically ill, I think it's a must. So I give it an A+. I highly recommend it. Definitely pick this up. You can get it online. You could probably get it anywhere. I don't know if there's an audiobook, but you can get this book, I'm sure, anywhere online. So definitely pick it up and wait for my next review. I have more books coming soon.